Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Before I introduce you to my guest tonight, I would like to acknowledge the traditional custodians of the land on which I live and work and pay my respects to their elders, past, present, and emerging. Please welcome my guest, Dr. Adhishwar Ghose, who's a general dentist and who I have known forever, it seems, because his parents and us are family friends. And he's known to me as Prince, as he is to all his other friends. And tonight we talk about the importance of oral health during the Dental Health Week. Hello, Prince, and thank you for joining me.
You're very welcome, Sally Auntie. Thank you for having me.
Always a pleasure. Always a pleasure. And before we launch into the questions as to why oral health is important, can you tell me something about yourself, please?
Yes, sure. So, as you said, my name is Adhishwar Ghose, but that's a bit of a mouthful for most people. So, we've shortened my name to Dr. Dish, which is
What a
what
lovely
all
name, Dr. Dish. And and I'm sure people watching will agree that you are a dish.
Thank you, thank you. And a funny story, actually, dish in Turkish means tooth. So that worked
Oh,
out really
okay.
well. Yeah, so I was born in Bangalore, India. We moved to New Zealand when I was only 2 years old. So I was pretty much brought up in New Zealand, 2 hours north of Auckland in a town called Whangarei. Then from New Zealand, I moved to Australia to do high school, and back to New Zealand to do university, and then back to Australia to work. So for most of my life, I've just been jumping between Australia and New Zealand.
And you have your own private practice now.
I do indeed, yeah. So I guess my journey really started at the end of 2018 when I graduated from dental school in New Zealand. Through the uni selection process, I was offered a job back in Auckland to work, which was starting in Feb. So I thought, before work starts, I'll come back to Australia and work in a dental clinic part time. And it just so, it happened to be that this clinic was for sale. And I actually found out about this clinic through a very close family friend and mentor, Dr. Debraj uncle and his wife Thanya auntie, and they were the people who introduced me to this clinic. So, through a series of events, we actually ended up purchasing that clinic. So this was in early 2019. So, as you can imagine, the process of a fresh graduate buying a dental clinic and just learning how to run a business in itself was incredibly difficult. But thankfully, due to the immense help and support that I received from their Raj uncle and from Tiny Auntie, it made the process a lot easier and a lot more straightforward. And of course, limitless support up until this day from my mom and from my dad, and it just made everything so much easier, and everything was very, very successful. Um, so after purchasing that clinic, our next step, I guess, was to make it grow and prosper, and take it to another level. So we implemented many strategies and many new initiatives. And for some of those initiatives, I'd also like to make a few shout outs to Nilanjan uncle, who is another very close mentor and family friend who's helped me and given me some great advice that really helped us get us on track. And I wanted to also thank Praveen and Anisha and the team at 360 Degrees Dental Marketing, who helped brand Dazzling Smiles Dental, which is what the clinic is called. And our vision, I think, is to provide safe and comfortable dentistry to all Victorians.
Thank you. There are a few people watching. Rizwan, hello. Thank you for watching. Hello, Shahrukh. Good to see you. Here you go. The fan following has started. Um, Hello, Rupa. Rupa's very proud of you. Thank you for watching, Rupa. Um, why did you choose to become a dentist?
Look, from a very young age, I've always been interested in the health field, biology, science. That's always, piqued my interest. And I've always wanted a job where I'm up and about, communicating with people all day, and getting to use my hands. I never really wanted to be stuck in front of a computer. So that in that aspect, dentistry has just ticked all the boxes. Dentistry is also a career which is very versatile. You're dealing with different people every single day, and that means that no 2 days are ever the same. And I think that dentistry is also a very rewarding career because you first of all help give people a smile, and change, and a smile can really change someone's life. So giving someone a smile and that confidence is really, really rewarding. And it's also just rewarding to help someone, simply get out of pain if they've got a really bad toothache.
Thank you. So now we talk oral health. Why is oral health so important and why should we take care of it? And I'm going to ask a question which I remember asking you when we caught up for a chat, Prince, which was, you know, when we were growing up and even now, and this is your parents' age group, we were told that after every meal you go and rinse your mouth. And I still do it every day. Every day after
Hmm.
every single meal, whether it's a cup of coffee or tea or lunch, dinner, breakfast. That doesn't happen anymore.
Mm.
So why has it
Yeah,
stopped, and why is oral health so important?
yeah, that's a very interesting thing, and I'm in the exact same boat as you. From a very young age, washing my mouth after every single meal was staple, and to this day, it's still something I do. Obviously, it makes it harder when you're out and about and at work and things like that. But when I'm at home, washing my mouth is just very important to me, and it's something I've always done. I think it's something that's really vital because it just helps get rid of any extra food debris and bacteria that's stuck in your mouth, or and it just helps you give a bit of a fresh feeling after a meal. I think it's also a cultural shift that has led to the change that we're seeing. I think that with a lot of people moving away from home and moving away from their country, they start to lose touch with a lot of the things that they used to do. And I think washing your mouth out after a meal is one of those things. So I think it's really, really important, especially for the younger generation, that parents still teach their kids to do these same things because it really does make a big difference.
Um, and how many people are brushing their teeth twice a day? How many do you see in the clinic who
Not
say we brush our
not
teeth
enough.
twice a day?
Really, really not enough people. I think only 1 in 5. These are official. So only 1 in 5 people in Australia, I believe, brush 2 times a day, which is not enough. And that actually reminds me, Zalia, one of the the issues with rinsing your mouth. When you're rinsing your mouth after a meal, that's really, really good. But a lot of people rinse their mouth out after brushing their teeth, and that's something that's really, really not good. We
Oh,
want to, yeah, it's a very common misconception, and it's a very common thing that I know I grew up learning, that you
yes,
brush your
I
teeth
did
and
that too. I still do
yeah,
it.
exactly. That's not actually a good thing because after we brush, we want to spit out the paste, obviously, and clean our tongue, but we want the residue of the paste to actually remain in our mouth and around our teeth. We don't want to get rid of that.
Okay, that's something new that I just learned. I have to
Mhm.
stop myself from doing it tonight.
It takes a little bit of time and a little bit of practice, but
Yes.
it is vitally important.
Thank you for that. Um, there, Rupa too has learned something new. There you go. I will, yes, every day, new learning. Um, so, Prince, when should a parent start brushing their child's teeth?
So the a child's first tooth, and it's different for all children, but a child's first tooth usually comes out at around 6 months of age. So that's a good time that parents should start cleaning their children's teeth, and not only their teeth and their gums as well. So at this age, you don't really need to be using a brush of any sort. Just cleaning their teeth with a wet cloth and some warm water is more than enough. You need to make sure that you try and clean all surfaces of the gums and the teeth, and it needs to be cleaned 2 times a day. 2 times a day, once in the
Oh,
morning and once at night before during dinner
going
time.
to bed. Yeah. Oh,
Yeah,
wow.
before going to
Okay.
bed after dinner. And
So I
it's
remember
really
when
important.
yeah, sorry, no, go.
I was just saying that it's really important, even from this young of an age, when you get these habits in place, it makes life a lot easier as they grow older.
When the girls were born, I was told to wipe their gums with honey. Does
Mm.
it help, or is it just because it's sweet?
I think just because it's sweet. Look, honey does have a lot of medicinal properties, but it's also high in sugar. So I think the sweetness does help a lot.
New things. Yeah, well, I remember doing that for both the girls. Um, how do you take care of toddler's teeth? So we are talking what, um, year and a half, 2 years of age?
Yeah. I think because we have such a broad audience, we can probably cover quite a few
Yeah.
age groups. But when we get into toddlers' teeth, a lot of the fundamentals remain the same. So we have to remember that no matter really what age you are, the brushing needs to be happening twice a day, once in the morning after breakfast and once at night just before going to bed.
Sorry,
Now,
once in the morning after breakfast.
yes, another very common misconception: after breakfast is always a good idea.
Okay, so not as you wake up and brush your teeth.
Yeah, so what I recommend is after you wake up, you can wash your mouth out a little bit and do a little bit of a brush. But what you want to do is after you have your morning meal, you want to brush your teeth so you can get rid of all the food and debris from your morning meal. And throughout the day, you've got a slightly cleaner mouth. Otherwise, you've just brushed your teeth in the morning, which is fantastic, but then you've eaten food and dirtied the environment again within a couple of hours.
Okay, Rupa, I'm sure you've learned something new because I've just learned. And here is what Swaroop says. Eva does that. So I
Good.
think he was the only one who does that. I know Tintin does that. And I was very surprised when she started doing that when we moved here because her friend taught her to do that.
Mm,
Because all of us wake up, brush our teeth, have breakfast, rinse our mouth, and whatever meals we have. But okay, so two things I've got to do now. Oh God, Prince, you're
yes.
asking me to do too many new things.
Yes, and we're only 10 minutes in. There's a lot to come.
And we're only 10 minutes in. Yes. Um,
Another really good thing for toddlers is that you can probably upgrade from, a cloth that we're using for the younger children to a soft brush.
okay.
And make sure that the kids aren't swallowing the paste as well. It's not a good thing to be swallowing too much paste.
So how do you stop that?
Well,
If
we
you're two
we
years
a bit of a
old, I mean,
learning. Yeah, look, when they're young, it is very hard. At the 2-year-old mark, you can even get away with not using too much paste. A very, very, very tiny amount of paste is all you need, and it just takes a little bit of time to teach them to try and spit it out, or get them to at least rinse their mouth a little bit after, so they're not swallowing it too much.
so here's something we never talked about, but I'm going to ask you because I suddenly visualize children's toothpaste and toothbrushes. So,
Mm,
uh, whenever you go to the chemist, you constantly look at, you're seeing uh, toothbrushes for children, for toddlers, and toothpaste that are different from the adult toothpaste. Should you
correct.
buy a children's toothpaste for your child, or can they just use the toothpaste that we do?
Yeah, so that's a really good question. I would recommend that for kids up until the age of about 6 years old, I would say that they should be using a children's toothpaste.
Okay, what's the difference?
So the difference between a children's toothpaste and the adult toothpaste, in the most part, is the content of the concentration, rather, of fluoride, which is a
Okay.
substance that is part of the toothpaste. Fluoride, and I don't know if we were going to touch on this later, but it's probably worth talking about. Fluoride
Yes.
is a substance that helps teeth become nice and strong. So it's a really good thing, and it's in the water that we drink, and it's in the toothpaste that we use to brush. So you need to have the right amount of fluoride. If you have too much fluoride, it's a bad thing, and if you have too little fluoride, it's a bad thing. So the reason why you want to use a child's toothpaste is because kids don't need too much fluoride, not as much as an adult. So their toothpastes have a lower concentration of fluoride.
Okay. Thank you. Um, so the next question, which I would like to know, and I'd like to tell Sammy and Tintin, is what's the right age to go to a dentist?
So the right age, I would say, is probably around 2 to 3 years old. So
Really?
that's mostly for, yeah, the parents with young kids. That's when you should start taking your kids to the dentist. So at 2 to 3 years old, most children will have most of their baby teeth, if not all, most of their baby teeth already erupted in the mouth. So when they have those teeth erupted, it's a good idea to take them to the dentist just so you can make sure that everything is developing normally and the teeth are being kept, nice and clean, and the teeth and the gums are looking healthy. But we have to remember that at that young of an age, obviously, when you go to the dentist, there's not going to be any major treatment or anything like that done.
Yep.
It's mainly going to be just for a general checkup. We have to really, really try hard as dentists to make sure that that first visit is something that's fun, something that's friendly, and we need
Yep.
to make sure that it's a positive experience for the kids. We don't want them being scared of anything in the future. So we need to, get them down on the dental chair, we get them exposed to having a bib on them and the glasses and, the big light and the fact that the chair moves up and down. It's really important to get them exposed to those things from an early age because it makes things a lot easier in the future.
Um, so do you have, should they go to is there a term called pediatric dentist, or is it just general dentist even for children?
So correct. A pediatric dentist is a dentist who specializes in seeing children.
Yep.
When we're talking about, getting general checkups and general cleans, you can go to a general dentist. If there's certain issues that your child has that needs to be, fixed and they're complicated, that's when a general dentist would most likely refer you to a pediatric dentist.
But would you have complications with your teeth when you're 2 and 3?
You definitely can. You definitely can.
Okay,
Some,
what kind of complications?
so the development of some kids' teeth sometimes isn't good, and that leads to problems in the future, and for which you need to see a pediatric dentist at an early age. And even not even when you're 2 and 3, but even when you're 5, 6, 7, and 8, you can have just as many problems as an adult will have because you've got a full set of teeth and you've got some adult teeth and some baby teeth. And some of those procedures which some kids might need are quite invasive and quite complex, and sometimes they're just a bit too much for a general dentist to be handling.
Wow.
Yeah. Which
Uh,
is why it's just as important for kids to be taking care of their teeth as it is for adults to be taking care of
yes,
it.
of course.
Yeah,
I wish we were taught about this earlier on. We never did, but anyway, never too late to learn. Just learn
exactly
two new
right.
things. So, not to rinse your mouth after brushing your teeth. Just spit
Mm.
it out, and you just let the toothpaste be in your mouth? That's kind of a
Yeah, I think that once you spit out the toothpaste and you brush your tongue, it pretty
yeah.
much gets rid of most of the paste. The rest is just a very light residue that can sit around your teeth.
And brushing your teeth after breakfast, not before.
That's always a good idea.
Yep.
Yes.
Two new things. Thanks, Prince. Uh, okay. Yes, Swarup says we are learning from a young doctor. Absolutely. Um, so now let's talk. We finished the toddler age. We're talking about 6 to 12 years of age when children start losing their teeth. Um, at what age do children start losing their teeth? That is my question to you. And what should parents know at this stage? And shall I ask the next question? No, I'll. You're getting too many people commenting. Hello, Rintu. So Rintu's here. I'm going to do that from tomorrow. There you go. Thank you for watching, Rintu. Okay, so let's
Yeah.
talk 6 to 12, and yep,
Mm. So yeah, look, 6 to 12 is a very, very happening period for kids and their teeth. During this period, parents should be prepared for a lot of change because during that period is when all the baby teeth fall out and it's replaced by the adult teeth.
yep,
So no matter what the change, whatever the change that's happening in the mouth, we have to remember again, we keep the fundamentals the same. So we need to make sure that brushing is still happening twice a day, once in the morning after breakfast, once at night after dinner. And we need to maintain a healthy diet as well. When we'll touch on a healthy diet in very shortly. Also, we need to remember that we've now upgraded from using just a cloth or something like that from through the toddler age through the kids age to using a soft brush. Now, what we'll notice with the
Sorry, can
kids,
I just interrupt you there? Are we
yes, of
still,
course,
are parents still using a soft brush for their children
yes,
between 6 and 12? Okay.
I agree. Yes. Look, a soft brush, I think, needs to be used all throughout your life. I don't
Oh,
think that
okay.
you need
Okay.
a medium brush and a hard brush are sometimes too aggressive. And when you're using a hard brush with hard bristles every day for your life, it can sometimes lead to a little bit of damage for your gums and your teeth. So I would recommend a soft brush for everyone.
Okay. So sorry, I interrupted you there, Prince.
No, that's okay.
Um,
That's okay.
what
So
should
yeah,
parents do at this age? Yeah.
as I was saying, it's probably at around, and it's different for all kids, but it's usually at around 6 to 7 or 6 to 8 when you're going to notice the first baby teeth start to get wobbly and fall out. Usually, it starts at around the center of the mouth, on the top and the bottom, and it works its way backwards until it's at the very end. Now, and the whole process is going to finish at about 12 to 13. So it takes a long time with a latent period in the middle, but we don't need to be concerned if, some kids are a bit early and some kids are a bit later. Um, Another really, really common thing that I get asked a lot during this phase is that what happens when you've still got a wobbly baby tooth and an adult tooth growing?
Oh, wow. Does that
And
happen
it does. It's very, very
next to each other?
common, right next to each other, right next to
Wow.
each other.
Okay.
A very common occurrence, and it's something that parents see and they get, very worried, understandably. But I just want to say that this is not something that you need to be immensely worried about. I would still recommend that if you are worried or concerned, go to your general dentist and have them, take a look at it. But it's something that happens quite often, and in most cases, all we need to do is give the baby tooth a little bit more time to wobble its way out.
Yep. Okay.
Yeah.
I want to ask you about braces, but
Mm.
there are lots of questions for you. So, hello, Ranjan. Great advice from my dentist. Um,
Yeah, braces.
Dashini Pillai wants to know, yep,
Go ahead. Go ahead.
what's your advice on toddlers having milk before bedtime or overnight and overnight?
Look, having milk over bedtime and overnight is not too good of an idea. As soon as possible, it's a good idea to try and wean them off having milk throughout the night. And the reason is that milk is just another, it's a type of food, and it's something that the bacteria in your mouth can feed off all throughout the night. And when bacteria in your mouth are feeding off this, constant supply of energy, it's this bacteria that leads, it's this bacteria and its byproducts that leads to holes in the teeth and to problems with the gums. So we want to, try and keep that nighttime period free of any food or drink.
Okay, thank you. Um, Hello, Jaya. Thank you for watching. So, Jaya wants to know, in India, tongue cleaners are widely used. Yes, I used to use them. Why is it not so here?
Yeah, I don't really know why tongue cleaners aren't used as widely here. I don't. I think it could be that people do, brush their tongue just as much, but they don't actually use a tongue cleaner. They just use their brush
Yep.
because that's what they were taught. But no matter what you're using, cleaning your tongue is a vital, vital part of keeping a healthy mouth and a healthy and a clean mouth. So whether you're using, the metal tongue cleaner or a plastic one, or you're using the back of your brush, or you're using the bristles, whatever it is, you need to make sure that you are doing that.
Thank you. Uh, Prince, what is the right age to wear braces?
I would say that the right age to wear braces is between 8 to 14. And again, this it depends on case by case. But traditionally, braces are used after the baby teeth have all fallen out and most of the adult teeth have come into the mouth. So that coincides with that age between 8 to 14 when that process is happening. And I think braces is one of the things which is really looked upon within our, overlooked rather within our community. Braces are really, really helpful for a variety of reasons. Firstly, it gives kids a confidence boost. If kids have a nice straight smile and white teeth and lovely teeth, it gives them a lot of self-esteem and confidence. Secondly, the functional aspects. When you have straight teeth, it's much easier to eat food And thirdly, when you have straight teeth, it's a lot easier to clean as well. When your teeth are crooked, it's harder to get in all the nooks and crannies and
Yeah.
make sure that everything is clean. So I would say
Is
about eight
yeah,
to 14.
8 to 14. Would all your
Yeah.
teeth, would all the milk teeth fall off by 8?
Not by 8, maybe a little bit after 8. But the important thing is to, I think it's important to have a consultation with your orthodontist earlier rather than later, because that way that they can make a plan so they're ready and prepared once all the milk teeth have fallen out.
Okay. Um, so, you know, parents not going in for braces, is cost an issue? Because is it covered under Medicare?
Unfortunately, no, it's not covered under Medicare. So cost is definitely an issue. Most again, don't quote me on this, but most braces you're looking at upwards of $5,000. So cost
Wow,
does come into
really?
the factor. Yeah, unfortunately.
5,000.
Mhm.
So, when you're wearing braces, do you have to keep changing it every year, every 6 months? Oh, how does it work?
It's not so much that the braces themselves are changed, but the wires and the tightening and things like that are done to the same braces, which allows for the movement of the teeth.
And obviously, that costs more money.
Yeah, look, the more complicated the process is, or the more misaligned the teeth are, the more expensive it will be.
Yeah.
Yeah,
Um, so teenagers, my favorite years, when
yeah.
kids are at their worst, I would think, or at their best, whichever way you look at it. They don't listen to parents, they have a mind of their own, they do their own thing. Um, how would you tell them to look after their teeth? Because teeth is not priority.
Mm. Unfortunately, it's not. Only becomes a priority much later in life, I'd say.
I know
So
that.
yeah, with teenagers, I think pretty much after yeah, starting from teenagers, it remains the same going all throughout life in terms of how you should be taking care of your teeth. So the next few things that I'm going to talk about are applicable not only for teenagers but also for adults, and also going into their elderly ages as
Yep.
well. So I'd like to break it down into four main areas. The first area is brushing your teeth. Again, I've repeated this several times and I want to say it again. Brushing your teeth has to happen 2 times a day, once in the morning after breakfast and once at night before you go to bed. We have to make sure that we're brushing with a fluoridated toothpaste. So you could be using your Colgate or Sensodyne or Oral-B or any of those brands. Make sure it has fluoride in it. Now, you don't want to be using a huge amount of toothpaste, just enough to cover your brush. That's more than enough. Now, when you're brushing your teeth, you have to be using circular movements, and you have to make sure that you're hitting all surfaces of all the teeth. A really common place that a lot of people forget to brush is behind their lower front teeth. That's an area where we see a lot of bacteria build up in our profession, unfortunately. So you have to make sure that you're hitting all those parts. Another really common question that we get is electric or manual, which one is better?
Yes, I was
Um,
going to ask you that. Yes, thank you.
yeah, so look, the answer is it doesn't really matter. Recently, studies have shown that the electric toothbrush is a little bit more effective because it does those circular movements for you already. But as long as you are hitting all aspects of the tooth and you're brushing twice a day, and you're using the correct toothpaste and you're brushing for 2 minutes, it won't make too much of a difference.
Thank you. We have questions, so I will. Oh, Ananya's watching. Hello, my darling. How are you? Thank you for watching. And she has something for you. Yes, Prince Dada's
Thank
fantastic.
you. Thank you.
Um,
And
Jaya
sorry,
wants. Sorry.
before I just to interrupt you one more time. The second thing that's really important is flossing your teeth.
Yep.
Um, it's by far one of the most important things in terms of oral health, but it's also one of the most overlooked things and neglected things. Brushing your teeth does not clean in between your teeth properly, and it does not clean under the gum line properly. So, if you're the only way to clean in between your teeth and under the gum line is to floss. So if you're not flossing, it means that you're leaving a huge amount of bacteria in your mouth, and it's this bacteria and its byproducts that is going to lead to holes in your teeth and lead to gum disease.
Um, Here, I'm going to, I have more, okay, let me ask you this question. So you have those interdental toothbrushes now? Are they
Yes.
okay, or do you still need to floss?
No, an interdental toothbrush is just another way of flossing,
Yep.
and they are okay to use.
Okay. So here is a question from Jaya. What happens if the enamel of the teeth start to wear out because of overbrushing? Does that happen?
Yeah, look, you would have to be really, really, really over brushing with a really, really hard brush to make that enamel wear out. But yes, unfortunately, it can happen, which is one of the reasons why we really, really stress using a soft brush. You don't need to be using a hard brush because that's what can lead to that wear in the enamel. Now, another thing that can lead to the wear in the enamel is having a lot of acidic drinks like
I was
alcoholic
going to
drinks.
ask you that. Yes. So,
Yeah, citrusy drinks or alcoholic drinks can also lead to wear of the enamel. Now, if that happens and it's getting to a point where there's a lot of sensitivity, or there's pain or any other issues in terms of how it looks, you'll have to visit your dentist and you'll have to get some sort of capping done or some sort of filling done onto your tooth to cover up that area and give that tooth a little bit of extra strength.
okay.
Mm.
So Rintu says you explain like a teacher.
I'm used to it every single day.
Okay. You can answer this question. Hi, Tanima. Is it okay to floss if your gums bleed?
Yes, this is a really, really important question. Healthy gums should not be bleeding. So if you, it's a very common misconception that people have, is that they start flossing and the gums start bleeding, so they think that they've flossed too hard and that they've cut their gums. That's very rarely the case. When you've got a really high amount of bacteria in your mouth, the body tries to fight the bacteria by sending blood to the area. So that's why the gums swell up and they become red and they become inflamed. It's because the body has sent a lot of blood there to try and fight the bacterial overload. And that's why when you floss it, it starts to bleed. So a really common analogy that I use, if you have your hand and you started to scratch your hand and it started bleeding, you'd notice that, hang on, something's not right. Something's wrong with my
Yeah.
hand. I need to get that fixed. It's the same thing as your gums. When you're brushing and when you're flossing, if it starts to bleed, it's your body's way of telling you that something's not right. I need to be fixed. So if
Okay.
your gums are bleeding, that means you need to floss more. It's not until you're flossing every single day, once a day for a period of about 2 to 3 weeks, that you'll notice that the bleeding stops.
Okay. Thank you. So now I'm going to ask you some typical questions which I think many of us want to know. So what are the typical issues that you see at your practice, Prince?
So most of the issues that we see at the practice revolve around cleaning of the teeth, people who have holes in their teeth, people who have infection, and people who have broken teeth. So mostly, day-to-day cleaning is a very, very common procedure that we complete. And that's what is needed when people have a buildup of bacteria around their teeth. It's commonly known as plaque or tartar,
Yeah.
and it's the yellowish, whitish thing that you can see
Yeah.
building up around the gums. So removing that, and of course removing your general staining from food and drinks, is a very common thing that we deal with. Another very common thing is filling up holes in teeth. So we've talked about it a few times, the bacteria in your mouth. It's this bacteria and its byproducts, the acid that it releases, that eat away at the teeth and cause the holes. So if you have a hole in your tooth, the dentist, or my job, is to do two things. Firstly, we need to clean up the hole and remove all the dead tooth structure and bacteria. And once it's nice and tidy, we need to fill that hole back up so you have a nice strong tooth. So that's a very common procedure that we do. Another very common procedure that we do is root canals. And there's a lot of misunderstanding about this and misconception about this. So I think it would be a good thing to talk about. So a root canal is what, well, a root canal is the procedure that's required when a tooth becomes infected. So if you have a hole in the tooth and it's a small hole, all it requires is a filling. But if the hole in the tooth gets so big that it infects the nerve of the tooth, that's when you require a root canal, because you need to not only clean out the hole, but you also need to clean out the infected root canal system of the tooth to clear the infection. And the final very common procedure that we see is doing crowns. So a crown is just another word for capping a tooth, and it's required when the tooth has a lot of decay, or if it's fractured, or if it's broken, or if it's had a root canal done. So a crown is effectively a cap that goes all the way around the tooth, and it gives it a little bit of extra strength and support.
So does it mean you have to take out the broken tooth, or does it just sit like a cap over the broken tooth, if that's what it is?
So what we would do is we would remove any of the broken parts, and we would take a little bit off the top of the tooth and a little bit around the outside of the tooth. So all that's left is nice, strong, healthy tooth structure, and that's what we would glue the crown onto.
Okay. Hi, Rono. I will ask you a question because I'm coming to that. Give me 2 minutes. Um, let's do this anyway. Let me be kind. Uh, is it better to extract or do a root canal?
That's a really good question, and I think that's a question that comes up in a lot of people's heads when they're at the dentist, and they hear the price of a root canal and they hear the price of an extraction, and it's almost a no-brainer. But from a dentist's perspective, I would always suggest, if it's feasible, and of course it depends case by case, but if it's feasible, do a root canal as opposed to extracting a tooth. And the reason why is because a root canal clears the infection, gets you out of pain, and it lets you keep your own natural tooth. Once you take out a tooth, it's gone for life. You're never going to get that tooth back. Nothing's going to grow back. So it's always best to try and save the tooth if possible.
But root canals are very, very painful, aren't they? I mean, I don't have any problem with my teeth, but I've heard root canals are really painful.
Well, look, in this day and age in dentistry, none of the procedures that we complete should have any pain associated with it. So before we would do an extraction or before we would do a root canal, we would make sure that the patient is completely numb, so they're not
Yeah.
feeling any pain. So in that way, no, there will be no pain during the process. You will feel pressure and you will feel things, but you won't feel any pain.
And how long does it take to heal?
So the root canal is the procedure is a long process. It usually happens over 3 or 4 appointments, spaced out between 2 weeks. After the first appointment, there is no more pain, but it takes a long time for all the bacteria to be killed. So it's usually about 2 or 3 weeks.
Wow, long time.
Yeah, but again, there should be very little to no pain during the healing process as well.
Okay, all right.
Yeah.
Um, cleaning and staining.
Mm. Yeah,
I
cleaning and
have to go and
staining.
get my teeth cleaned every 6 months.
Yeah, just like we were talking about before, a very, very common thing. The cleaning and staining is something that a lot of people need to make sure that they're visiting the dentist at least twice a year. So that's every 6 months. If the dentist says that you need to do it earlier, then you need to go in more often, but at least 2 times a year. And a lot of people may feel like they've got a clean mouth, or they look at their teeth and they think that it's clean, but there's a lot of staining or bacterial buildup going on under the gum line that you can't see, and that's why going in for your regular cleaning is very, very important. And I think it's an important thing to touch on as well is that a thing about dentistry and dental disease is that a lot of the time it's painless until it's too late. So
Yeah.
a lot of people think that if I have no pain, nothing's wrong, but that's really not the case. It's really a recipe for disaster if you don't go in and get your regular checkups, even if you have no pain.
So I'm going to ask you a very dumb question. So I go for my cleaning every 6 months.
Mhm.
So does the enamel wear off with every cleaning?
No,
Nothing. Okay.
no. The cleaning tools that we use, they're very They vibrate the teeth a little bit, and that's what helps get off the bacteria and the buildup of plaque. But it does not damage your teeth. We wouldn't be doing dental cleaning like that if it damaged your enamel, because we have to remember that enamel doesn't grow back. So as dentists, we really, really like to preserve enamel as much as we can. So no, enamel does not, get damaged in any way during the cleaning.
Okay. Thank you.
Otherwise,
Filling. What does it mean? And then anyway, we've done root canal and crown, so I know that.
yeah.
What does a filling mean?
So yeah, look, a filling is what it needs to be done when you have a hole in your tooth.
How do you
Um,
have a hole in your tooth? Please
so
explain that to me. I know you said talked about it before. How would you get a
yeah,
hole?
so the teeth are very, very resilient. They're one of the most resilient and strong, materials that we have in our body. But even teeth, unfortunately, can succumb to, getting damaged. The way that it gets damaged is because the bacteria in our mouth release acids, and these acids slowly erode away at the teeth, and that's what causes it to make a hole.
Wow.
And it happens over a long period of time. And as I was saying before, the bad thing about it is that the holes are painless until it gets very, very deep and close to the nerve, and that's when things are often too late.
Okay. Uh, Teeth whitening. We get so many teeth whitening toothpaste now. None of them
Mm,
work. I have tried charcoal and this and that. Nothing works. Like zero.
mm.
I
Yeah,
all feel they're
yeah.
marketing gimmicks. Are they?
Yeah, I think especially in the last couple of years, teeth whitening on social media especially has blown up. With social media influencers showing so many things about high smile and this toothpaste and that toothpaste and these strips and that strips. A lot of it is a marketing gimmick, but there is ways to whiten your teeth that do actually work. What I would always recommend is that if you do want to get whitening done, make sure that you get it done with your dental professional. And if you want to do at home whitening, make sure you first consult your dental professional.
Can you do
Um,
it at home?
yeah, there are ways in which you can do whitening at home. So what whitening does is that it temporarily removes the outer stained layer of the tooth. Now, this layer is something that will grow back. It's not going to, permanently damage your enamel or anything like that. It's a common misconception. It just removes the stained layer above the enamel. Now, what we use to remove that enamel is hydrogen peroxide, which is also known as bleach. Now, when you're using it at home, you use a very, very low concentration of hydrogen peroxide or bleach, and you often put it in a little mouth guard type of tray that you put into your mouth, and you just let the hydrogen peroxide sit around your teeth, and that layer of stained tooth will come off.
So hang on, Prince. And not, it is safe to do that?
Yeah, when you're doing it at home and the levels of hydrogen peroxide are very low, it is safe to do so, but you can't do it every single day. It's something that you need to do in moderation after consulting your dentist, because everyone's teeth are different.
But otherwise, I mean, so you're saying it is safe to whiten your teeth, and if you do it at home, talk to your dentist first before doing it yourself.
Yes, agreed.
Okay.
Yeah, some of the long term, if you're irresponsible with whitening your teeth at home, some of the long term impacts can be, damage to your teeth, and you can have long term sensitivity, and you actually get some of this damage as well if you're using the charcoal toothpaste and whitening strips and abrasive brushes and things like that too much. You can get long term sensitivity.
And if you were to whiten your teeth at a dentist,
Mhm.
what's the interval like? Is it once a year, once every couple of years, once every
Yeah,
six
we
years?
would probably no. It's look, when you get whitening, it usually lasts between 1 and 2 years. So it's safe to whiten your teeth. I'd say every year is okay, as long as you're getting it done at a dental professional
And
at your
nothing
dentist.
happens to your enamel?
No, there won't be any long term damage to the enamel.
Okay. Um, Bleeding gums.
Mm.
Why?
That's another big, yeah, another big thing that
Why does it
I think
happen?
that we touched on earlier, but super important. So I want to stress it again. Your gums bleed because you've got too much bacteria in your mouth, and your body tries to fight that bacteria by sending blood to your gums to fight it. So your gums swell up and they get red and puffy and inflamed. And when you try and floss and when you try and brush, they start to bleed. So once again, the bleeding gums is just your body's way of telling you that I'm unhealthy or the gums are unhealthy.
Thank you. Okay. The minute you touch 21, or so we were told, wisdom tooth and extraction. Well,
Mm,
I've never had it taken out, but I know my family members who've had it, and it has been very, very painful. Should we?
yes.
Shouldn't we?
Yeah. Look, with wisdom teeth, it's really the luck of the draw. It's really interesting to know that not everyone actually gets wisdom teeth. So you have people that don't have any wisdom teeth, you have people that have one, and you have people that have two or three or four. So if you're really, really lucky, you won't have any wisdom teeth. And if you're really unlucky, you're going to get all four wisdom teeth. Now, wisdom teeth, as you said, they come out between that age of probably around 18 to 23. And when they do come out, they come out at the very, very back of your jaw, on the bottoms and on the tops. And because they're coming out at the very back, there's often a bit of a lack of space for them. So there's not much space for them to erupt. So
Is that
as
why
they
it
come,
hurts?
and that's one of the reasons why it hurts. Yeah. So there's a lot of, because of that lack of space, it needs to push everything out of the way. And during that pushing process, it can create a lot of pain. Now, the other reason why it hurts is sometimes when the tooth is half out into the mouth, it creates areas and pockets within the gum where bacteria can accumulate. And if a lot of bacteria accumulates in those pockets around the wisdom tooth, it can lead to infection, swelling, and pain. So that's another really common reason why wisdom teeth can cause pain. I would say that if your wisdom teeth are causing you problems or they have the potential to cause problems, it's always a good idea to have it removed.
Uh, so is there a reason why some of us have it and some don't? I don't think I have it because I've never felt any pain, or maybe it just didn't hurt. But is it a
Yeah,
good
there's
idea?
no there's no reason as such. It's, as I said, it's just the luck of the draw. Some people have it, some people don't, and then some people who do have wisdom teeth have they may have slightly bigger jaws, and the teeth might have more than enough room to erupt normally, and they may have no problems. At the same time, someone with a smaller jaw might have a lot of problems with their wisdom teeth.
Thank you. Okay, fluoride. We talked about it. And I remember you talked about people using natural toothpaste. I had never heard of it.
Yeah, yeah.
Whatever that
So
means. Yeah, okay.
yeah, one of the things with natural toothpastes, and I'm sure that it does have a lot of benefits. But one of the things that some natural toothpastes don't have is fluoride. And we talked about fluoride a little bit, but it's really
Yeah.
important. Your teeth are made of tiny, tiny, tiny crystals. And when you have fluoride, what the substance does is that it's actually able to combine itself with the crystals that your tooth is made out of. And when it combines with the crystals, it actually changes the structure and the chemistry of the crystals your teeth are made out of. And it makes the tooth a lot stronger. It makes it a lot more dense. And it makes it a lot more resistant to decay and to acid. So what all that pretty much means is that fluoride makes your teeth stronger and
Yeah.
less able to, you're less at a lower risk of getting holes in your teeth effectively.
Okay. As we get old, our teeth give us so much of trouble.
And they do,
So, how should
unfortunately.
you? Yeah, I know. So, how should you look after your teeth as you grow old? And if you start losing your teeth, I mean, I'm not talking um, very, very old, but I'm talking middle
Mm,
aged people too, when you
mm,
start losing your teeth, what do you do?
mm. Yeah, look, age is everyone's enemy, unfortunately, and age has
Ask
an
me.
impact. Yeah, no, not at all. Um, Look, age has an impact on everyone's teeth. But again, we need to make sure that no matter how old you are and no matter how many teeth you have left, you've got your fundamentals the same. And I think one thing that we forgot to touch on earlier that I want to quickly mention, obviously we touched on the brushing and we've touched on the flossing. The other thing that, and we've touched on visiting your dentist 2 times. The other thing that I want to touch on is maintaining a healthy lifestyle and a healthy diet. And that's super important as you age. You know, when you're young, your metabolism is high, you're able to deal with the junk foods and stuff that you eat. But as you get older, your body isn't able to process it as much and it goes straight to the waistline. So when in terms of your diet, we need to make sure that we're maintaining a low sugar diet, especially for the older generation. The
And the
sugar
younger ones?
and the younger ones for sure, for everyone. That means making sure that kids stay away from their chocolates and their sweets, and and even for the adults, making sure to keep sugar as low as possible because it's the sugar that the bacteria in our mouth feed on.
Yeah.
Now, when you do lose a tooth, unfortunately, whether it be because of decay or bone loss, what I like to think of it like a bookshelf. If you take a book out of the middle of the bookshelf, what happens is that the books on either side they fall inwards. Now that's exactly what happens over a long period of time in the mouth. When you lose a tooth, the teeth beside it begin to tilt because they're trying to fill the gap that has been created. And when you have tilted teeth, it makes it really really hard to eat because all the shape of your teeth have changed, and it also really makes it hard to clean. Another thing that we need to remember is if you lose too many teeth, it starts to change the shape of your jaw and the shape of your face and your smile, which is a really
You mean
really
it sags?
it does. It sags and it kind of dips in because we have to remember that it's our teeth and our mouth that keep our face, looking
Yeah.
nice and plump. And if you lose too many, everything sags in and dips in. Another really bad thing about losing teeth is that it means that the remaining teeth you have are under more force and under more pressure. You were chewing your food with 5 teeth before. Now, if you've only got 3 left, it means that those 3 teeth are doing the work of what 5 teeth should be doing. It means that those teeth are more likely to break or be damaged. So, because of these reasons, it's really, really important that when you do lose a tooth for whatever reason, you have to think about replacement options for your teeth.
And that
Now,
was going to be what I was going to ask you.
yeah, so there's 3 common options for replacement of teeth. The first and the most expensive, but the most long term, is implants, which are the little screw that gets implanted into your jaw. This
Wow.
is this is the most expensive, but it's the most long-term option, and it's the option that gives you the most realistic feeling of having a tooth in your mouth.
Sorry, Prince, I'm going to ask you there. When you say screws,
Mhm.
is the screw shaped like a teeth or is it, or what
So the
does it do?
screw the screw is shaped like a little metal screw, but that part is within your jaw that you can't see. On top of that screw is another piece that looks like a tooth, and that's what is in
Which
your
is made
mouth.
of enamel?
It's not made of enamel. No, it's made of porcelain or something else. It's not made of
Oh,
enamel. Yeah.
okay. Sorry. Okay. I didn't know about that. Okay. So one is that, the screw.
One
What
is
is the
yeah, one
second
is
one?
one is implants. The second is a bridge, and that's when you have a gap in the middle and you've got 2 teeth on either side. So you have a 3-unit bridge. So you glue it onto the teeth on either side to replace the gap in the middle.
And how long does that last?
Look, bridges if they're done really well, they can last up to 10-20 years.
Okay.
But it's really
And then,
important that you have to be maintaining it and making sure you're keeping it clean. Otherwise, it's not going to last as long.
and of course, I'm guessing the third one is dentures, which is what I was going to ask you. Yep.
Absolutely right. The third one is a denture. Now, a lot of people want to stay away from dentures because it's something that's clips in and clips on into your mouth, and you have to take it out at night when you go to bed and put it in a little cup of water, and everyone feels
Yeah.
like
A
an old
solution. Yeah.
person when they're doing that. But again, it's one of those things that's really really important because it allows you to maintain the shape of your face. It means that the remaining teeth you have aren't put under extra stress, And of course, it means that when you smile, no one has to see missing teeth.
Is it painful? I remember my mother would never wear her dentures, so she had a few teeth missing, and
Mhm.
it was a nightmare trying to get her to wear dentures. Is it painful?
If dentures are made correctly, they shouldn't be painful. They're usually made and designed so they fit very nicely into the shape of your mouth,
Yep.
and they can be adjusted if there's any sore spots and things like that. So if dentures are done properly, they no, there shouldn't be any pain.
Okay. We're nearly there. Nearly been an hour. So I'll ask you my last question. Um,
Mm.
Links between chronic disease and oral health.
Mm. Yeah, this is something that's really important to talk about, and unfortunately, it's another one of those things that's really overlooked. A lot of people think that their mouth is, completely separate from the rest of the body. A lot of people think that, I can have a lot of problems in my mouth and it won't affect the rest of my body. But unfortunately, we couldn't be further from the truth. There are a lot of studies that are showing that there are huge amounts of correlation between the health of your oral health, the health of your mouth, and the overall health of your body. And I wanted to just give you a few statistics here um, that I got from a book called Hygiene Superstar. Hygiene Superstar is a book that I recommend everyone have a read of. It was really eye opening. So some of these stats, the risk of head and neck cancer increases up to 5 times when an individual has chronic gum disease.
Really?
Men with chronic gum disease have a 63% higher chance of developing pancreatic cancer than men who don't have chronic gum disease. Recent studies have shown that a huge proportion, a number nearly coming up to 40 to 50%, of heart disease and heart attacks are triggered by oral infections. Chronic gum disease, women who have chronic gum disease are 7 times more likely to have a preterm birth. And gum disease and the number of pathogenic bacteria in your mouth lead to an increase in inflammation, and that doubles the patient's risk of heart disease, stroke, heart attacks, and diabetes. So there's huge links to chronic diseases that a lot of people deal with on a day-to-day basis.
This is scary. Wow.
Mm.
I don't think we are aware of it. I don't think any
I
of us.
don't think people are. No, they're really not. Unfortunately, for some reason, dental hygiene or dental care does take a back seat in our community, but it's something that we, as dentists, and we really need to shift. We really need to change, and that happens when we're able to educate people and let them know that the health of your mouth and the health of your body are very closely linked. If you have a healthy mouth, it helps a lot in terms of having a healthy body. And it all comes back down to controlling the amount of bacteria in your mouth. Because what happens is that if you can't control the bacteria in your mouth by your regular brushing, your regular cleaning, maintaining a sugar-free diet, and visiting your dentist, the 4 pillars, if you can't control the bacteria using those things, there is an overload of bacteria. So that bacteria starts to eat away at your bones and your gums, and it goes through the bones and the gums and gets into your bloodstream. And from the bloodstream, it travels throughout the whole body, and it damages your blood vessels. It damages cancer suppressing cells, which leads to a higher risk of cancer. So it's all about what that bacteria can do.
Wow.
Yeah.
On I will end this on a very positive note. So here you
Yes.
go. Thank you for watching, Neil. There you go.
I'm
So
glad.
many of us have learned new things. Thank you
Mm.
for so much for joining me, Prince. It's always a pleasure talking to you, and you know that.
You're
But
very
thank you
welcome.
for your
Hopefully, it wasn't too
time.
overwhelming.
All right, there's one more. So before we go, thank you for watching, Nilanjan.
Thank you, Nilanjan Uncle.
Thank you, Prince. Take care, stay safe,
Thank you. See
and
you. Bye
see
bye.
you hopefully soon.